Firstly, Minister, your government has inherited a lengthy elective surgery waiting list, which has been an ongoing major issue, particularly those living in Western Sydney. This obviously is an issue that can't be fixed overnight, but with an estimated 70,000 patients on our surgery waiting list, what initiatives are either planned or in place to reduce this?
Trevor, would you be so kind, as the Minister comes up, just to reiterate, if you've got the question. Thank you.
He's also submitted it previously, so I was aware of your interest in this topic. As has been described earlier on, the local health districts have been provided their budgets this year on the basis of anticipated growth in demand for elective surgery, so they've been funded to provide additional elective surgery operations, plus, of course, other hospital services. As well as that, there is an opportunity to provide health services in a different way. We heard the presentation from Auburn Hospital earlier about more effective ways to treat certain patients that move them through the system more rapidly and get just as good, if not better, outcomes. So there's a lot of work going on in that space. Do you want to add anything more than that, Mary? Or the local? Yes, Pat Cregan. He was the chair of Nepean.
Thanks. Yeah, I'm chairman of Nepean at present, but prior to that I was chairman of the Surgical Services Task Force from its inception until recently. There's a few important things that you need to realise when you start talking about surgical waits. First of all, is the number of people on the waiting list is a totally irrelevant number. It's the same as if you run a factory and you have an order book. The waiting list is your order book, and provided you're making enough widgets in a timely fashion, a big order book is probably a sign of success. So that waiting lists, absolute numbers on waiting lists, are not relevant. What's relevant is waiting times. Are people getting their surgery in a timely fashion? The answer to that in New South Wales is that yes, the performance in New South Wales is better than anywhere else in the country, and better by a country mile. They have targets around what are the various categories, 1, 2 and 3 and so on. In June of this year, and in June in fact of the year before, New South Wales actually came within a whisker of being what we call 0, 0, 0, of actually meeting those targets. Waiting times in Western Sydney are too long, and yes, we need to be putting more money and more services into the West, but overall, as a state, we're miles in front of everyone else.
Thanks very much. Thanks. I just got one other quick one. Following comprehensive testing, New South Wales Health is going live with clinical repositories, which includes the better management of discharge summaries and a new blue book for mothers of newborns. What do you see as the main benefits for the consumers with these innovative changes? That's going back to the old system where mums picked up a blue book and could monitor the baby's progress and so forth. That's been brought back in.
I'll first of all have a go at this, then Mary can. I mean,
right.
One of the things you might have seen if you were reading the press in the last few days is we have, and I personally as a minister, been very involved in the restructuring, in setting the sort of goals system-wide, but as part of our absolute insistence on devolution and giving the clinicians at the coalface a greater responsibility, but also a greater say in how things are done. I leave a lot of that to the local clinicians like Professor Patrick Cregan. He's a surgeon, he knows a lot more about this than I do. And so the same thing applies. But in things like the Blue Book that you've mentioned and some of those initiatives, I think there's a huge advantage in making those things available for patients, for parents particularly. I mean, the Blue Book, for example, is available, if not now, it's about to be on an app, so that people can go in, they can, instead of going along and to a baby health centre and getting their kid weighed and knowing when, this is there all for them. They can get a professional to put the info in, they can do it themselves. There's reminders about important immunisation responsibilities and so on. That's all part of the electronic patient record and the work that's being done